Right. Good evening, everyone. A very, very warm welcome to yet another Clicks Wellness Expert Panel webinar. I'm your host, Tarryn Trussell van Louw, and it is an absolute pleasure to be delving into a topic that is so serious, but yet so natural, and one that we are going to be, just unpacking today. Tonight, we are taking a deeper look into the significant phase of every woman's life. Yes, I'm talking about menopause and andropause if you're a man. These natural and crucial transitions impact your health, and it brings with it unique changes, challenges, and opportunities for growth and self discovery. Don't we just love that? We are constantly evolving and constantly learning. Now, as we delve into this topic, we want to empower you with the knowledge, unravel the mysteries, and of course, create a supportive space where your questions and concerns can be addressed. We have a wealth of knowledge. Let me tell you, I have got the best of the best in the game. Guys, we have a wealth of information and advice brought to you by our Clicks Wellness Expert Panel members. We have once again joining us the phenomenal Dr. Mpume Zenda, and new to the team, but also pretty impressive, we've got Professor Shingai Mutambirwa, whom will be joining us in just a bit. It's going to be absolutely amazing. I want you guys to feel free and comfortable and safe to participate in this conversation. This webinar is not only an opportunity for us to learn from the experts, but also an opportunity for us to share. This is a space where we want to share thoughts, views, questions, and we want you, our viewer, to engage with us. So let's engage in a dialogue that promotes awareness and encourages a proactive approach to our overall health. Feel free to ask any question. I always say this, there is no foolish question. There is no silly question because 99.9% of the time we're all thinking it. So please, I hope that this is a comfortable space where we can have all kinds of dialogue and unpack things that are on the heart and in concern. Guys, use the hashtag clicks wellness experts, followed by your question. I'm going to say that again, hashtag clicks wellness experts, your question, and one of our experts will then, of course, answer your question towards the end of the live. Now, it's that time. We're going to meet our amazing panel. Guys, they are here, they are ready to share. Let's meet our experts who will guide us through this critical and exciting topic. So, without further ado, I'd like to welcome our Clicks Wellness Experts members to the conversation.
Ah,
There you guys are. Welcome,
Evening, Tarryn.
welcome.
evening, Tarryn. How are you, my gorgeous?
It's so fantastic to be again in your virtual presence. I just think that, one's cup gets filled with so much information, so much knowledge, and so it's always a pleasure. How are you guys feeling?
I'm
Perfect.
great.
No problems. And thanks for and my surname, you say it better than me because I lived in Canada most of my youth, so I can't even say it.
Stop it. Right. Let's get into it. Let's talk menopause. Dr. Zenda, let's start the conversation with you. Okay?
Yes.
Could you please provide us with a comprehensive explanation of what exactly is menopause? What is this? How is it diagnosed? And of course, the key changes that occur during this very natural life transition.
Right. So menopause falls as part of the phases of the woman. So you get puberty, you get the reproductive phase, and then you get menopause. And this is because women are born with all their eggs within them, inside of them. That means there is a finality in terms of our reproductive phase. So from about the age of 35 years of age, we start our estrogen, or rather our ovarian reserve. Our ovaries begin to decline both in quality and in number. This then means that our sex hormones, particularly the estrogen, starts to decline until, so this can go on from about 35 all the way until somebody menopauses. Menopause in itself is that last period, or rather, it's looking back in retrospect after you've missed 12 periods or 12 consecutive periods. So it's not something that is like an event, it's a transition, and you don't know until you've missed 12 consecutive periods to say that you've menopaused. Generally, or on average, it happens between about 48 and 52 years of age. But there is a strong link between, there is a strong hereditary link. So if women look at, for example, their mothers and when they went into menopause, there is a strong correlation between when you will go into menopause as well. In terms of what then are you looking at in terms of the symptoms, how do we diagnose it? In terms of diagnosis, we generally will do what we call a follicle stimulating hormone test, which then tells us whether or not you have menopause. So anything above 15 to 20, we often assume that, okay, you have menopause. Anything below that is still considered, you're still kind of like in an ovulatory, you may not be getting ovulatory cycles every month. This is where the perimenopausal, we'll talk about that a bit later, and that can take about 4 to 8 years. So how do you diagnose FSH, which is a test, a hormonal test, and you diagnose menopause 12 months or 12 consecutive missed periods? Then you can say, I have officially menopause within that period of about 48 to 52 years of age.
Oh, okay. And then, of course, there is perimenopause, and that's often
Yeah.
referred to as the menopausal transition. Now, Dr. Zenda,
Yeah.
can you elaborate on this? Because I think a lot of our viewers and and our streamers are actually also wanting to find out about this thing called perimenopause.
Yeah.
What are some of the common misconceptions about menopause that you often encounter in your practice?
Yeah. So maybe with the first question in terms of what is perimenopause, this is the one that's often
Mm,
very misunderstood and we often miss because it can happen over a period of about 4 to 8 years. So remember I said from about 35 years, our estrogen starts to decline, the quality and the number of our eggs starts to decline significantly. And this is generally the first kind of symptoms that people will start to notice are irregular periods or a change in your period or your menstrual
mm,
cycle. The other thing that will generally happen is just that feeling emotionally. You get a decrease in terms of,
yeah.
energy, but this is actually more to do with your testosterone because it's not just the estrogen that is affected, but also the testosterone gets affected. So from a sexual perspective, they start to feel a little bit more like their libido is low. Things like cardiovascular and weight, metabolism drops quite significantly. And
Yeah.
so you find women complaining of, oh, I used to be able to just eat this and be able to work it out immediately at gym, and now I don't lose weight as easily as I used to. Other things that may start to fall into place is mental health issues. So more propensity of having things like depression, anxiety and stuff.
Yeah.
So it really does become important to know yourself in your normal so that you can start picking up these very subtle changes that occur during the perimenopausal phase.
Absolutely. And it's so important to have this conversation and normalize this conversation so that it's not a shock horror when the transition is starting.
Absolutely. I mean,
Absolutely.
I'm 40 and I went through this like a really big dip just like about 2 months before my 40th birthday. And
Yeah.
even as a doctor, it took me a while for it to click. Oh, snap. It's perimenopause. It was when I did the blood
Yeah.
test. It was when I went to go see my doctor that
Yeah.
I was like, oh, snap. Okay, so I need to just tweak a few things in terms of my lifestyle, in terms of
Mhm.
what supplements I'm taking, and just managing that appropriately.
That's absolutely amazing. Like more power to conversation. Women are women are of course not the only ones that experience this menopause. Men too undergo a significant hormonal shift during these periods. Professor Shingai, could you shed some light on andropause and common symptoms that are experienced? Because it seems as if, the spotlight's always on the woman, the moods, the sweating, the changes. But men, of course, go through something as well.
No, it's a great question, and Mpume has really just led the stage so well to get to what I have to talk about. I think
Mm,
we have more commonalities between men and women than actually we understand. Because even as she's talking about the different hormonal changes, she mentioned that, for example, testosterone, which is a so-called male hormone, is actually the most significant hormone for females to actually feel sexually stimulated. But similarly, the so-called female hormone estrogen is so important for bone health, for heart health, for men as well. And most of our estrogen actually comes from conversion of the testosterone, which is made in our testicles in peripheral fat, to estrogen. It's by a hormone called aromatase, an enzyme, sorry. And then, so I think it's so important to remember that we're very much similar in all of these things we're going to be talking about, whether it be the andropause, which we sometimes call testosterone deficiency syndrome, and various other things, are very similar when it comes to both males and females. But we must understand that for guys, our peak testosterone and sexual activities in the region of about when we're 18 to 22. About the time when we get to 30, our testosterone level starts to go down by about each year about 3%. And eventually it can get to the point where we actually get into significant symptoms very similar to menopause, be it hot flashes, be it depression, be it mood swings. All of these things can happen in men as well. And I think we have to remember that just guys, although it's quite a little bit different between females and men when it comes to fertility, as Mpume was saying, that females basically they start off with all their eggs and when they're born, and then by the time they reach puberty, about half of those eggs are all gone. And
mm,
then as we get older, they start disappearing. For guys, every year we still, I mean, every time a guy ejaculates, we're ejaculating between 15 and 250 million sperm per milliliter.
wow.
And
Yeah.
we think that, and it goes on for the rest of our lives, but the quality of these sperm are decreasing as well. So I think it's
Mm,
good for guys to remember that we've got very similar problems. We've got to remember that we're going to be changing as the years go by. And it's not a Mickey Mouse thing, as Mpume was saying, that if our testosterone and estrogen goes down, we're more likely, for example, if estrogen goes down, we're more likely to get fractures, bone breaks and stuff. If our testosterone goes down, we have sexual problems, erectile dysfunction. We're going to be having problems with feelings of having sex. We're going to lose our morning erections because the morning erections are very much related to the testosterone. And we also can go through those problems. So it's not like it's one size fits all. But and even these hormones Mpume was talking about, whether it be the chemicals that come from the brain that go down to the testicle or to the ovary,
mm,
telling them to make more eggs or make more estrogen or make more testosterone, they change as well as we get older.
absolutely. Now, on that topic, I quickly want to ask you, how is andropause diagnosed? What are the telltales of you've officially entered this era?
Okay. I think the important thing for guys to remember is that it's not, the testosterone is often very closely related to another gland in our body called the prostate, which is sitting just below the bladder, all the way around the pipe for passing urine, which is also the pipe for ejaculation, which we call the urethra. And once we're reaching around the age of 30, 40, we have to be remembering that the guys need to go for a couple of tests. And I think Mpume will back me up that women are far better at getting seen by their physicians. They see their physicians
Mm,
5 times more in their life than guys. That's why one of the many reasons why guys die about 6 years earlier than females. We can change that by actually just making the intelligent choice to make sure that we get ourselves checked out. So it's really quite simple for guys. What happens, first of all, is once a year, you should just go and see your treating physician. It doesn't have to be a urologist, doesn't have to be a GP, it can be a nurse practitioner, it can be anybody who you like, just to make sure that you get checked out, because there's basically 5 main problems that people get, basically, whether it be females or males, which are going to kill us and which we can change and adapt. And these are things that were related to physical activity, to the choices in food, to smoking, to not getting excessive alcohol and such, which, as Mpume knows, I'm prone to at times, and then of course also stress. And all these five need to be addressed. And when we're looking at the leading causes of death, they're essentially what we call non-communicable diseases, which is cancers and heart disease, which is strokes, heart attacks, loss of limb. None of these have significant symptoms when they're early and can be cured unless you get checked out. So go and get yourself checked out. It's a simple thing for a guy. What you do when you reach around the age of 30, you should be seeing your physician once a year anyways to get your blood pressure, get your cholesterol, get your sugar done. And then after about 30, especially if you have symptoms like, for example, decreased morning erections, erectile dysfunction, decreased libido, get your testosterone level done. When you reach around 40, you must add a blood test called the PSA, or prostate specific antigen. It's a blood test which we need to do to check for prostate cancer particularly. By the way, guys are very scared of the finger going up their ass to fix their anus. Sorry, I keep making a mistake. To check for the prostate. That's no longer part of the guidelines. We don't have to get that done anymore. It's just a blood test. Literally, you have to do this once a year. Literally, it takes you 5-10 minutes to go and see a healthcare provider. If you get them done, it's going to make a big difference, because even when you have low testosterone, the dangers are so many. They're not only about sexuality, but they're also about the fact that you're increased risk of getting heart disease if you've got low testosterone, getting prostate cancer. The bad prostate cancers are related to low testosterone. So simple. Literally 5-10 minutes in a year, you'll be fine. But you must go in and we assess the symptoms and then do these tests.
Wow. You're saying this as if it is common knowledge, but I think majority of men out there do not do the simple practice of going to their physician and just going to check. There's this thing of no news is good news, but in this case, it's not like that. I think it's a matter of, from the age of 30, it is a absolute vital visit once a year.
Exactly. And I think what we probably back me up again, that women in general are much more clever about this. I mean, we know that there's data to show that yeah, no, it's a fact. We know that from up to the age of 16, both male and female children have similar life expectancies, similar problems with cancer, similar problems with all of these things. But after that, men get worse. And the main reason is that guys, when we get older, we think, oh, the girls are saying, oh no, my parents were taking me to see a doctor once a year. I'm going to continue because they're clever. But guys say, oh no, we're tough. We're tough. We're not going to bother. And then that's what kills us. So I think we need to start taking our health seriously for guys particularly.
Yeah, no, ignorance is not bliss in this case. So, guys, just a reminder to engage with us and, of course, comment in that little comment section. Feel free to ask any questions, share your thoughts during this webinar. We want to engage with you. Hashtag clicks wellness experts, of course, followed by your question, and one of our experts will answer your question towards the end of the live. Now, Dr. Zenda, how crucial is maintaining a healthy lifestyle to better manage that hormonal fluctuation during menopause?
Yeah, it literally is part and parcel. And I often advise ladies, how you treat your body in your 20s, in your 30s will definitely affect how you kind of fare in your 40s and 50s. Things that become really important, we always just think of exercise and food, but it's a little bit more than that. When we think of exercise in particular, encouraging women, well, both men and women, particularly, we often do a lot of cardio as women. You need to add some strength training. This helps particularly with your bone density and to keep your bones strengthened. When we're talking about food, for example, whether or not, it doesn't matter in terms of the dietary, as long as it's balanced. But things that become important is adding supplements like, for example, calcium. Women often tend to get also things like brain fog. So keeping active active and just focusing on things that keep your mind working. You'll find, for example, things like meditation that decrease stress, things like find a hobby that you actually enjoy, because learning a new skill, those things keep your brain working. Over and above that, I think then, Dr. Shingai spoke about all the tests that needs to be done. So being impeccable with making sure that from the age of 40, so before then, we generally will do things like the pap smears, but from age 40, we want to do bone density scans. We also want to make sure that you've done your mammogram, because again, the risk of cardiovascular, risk of breast
Yeah.
cancer, risk of all these other things come to play. So lifestyle is not just about I'm eating well or I'm exercising. It's what type of supplements are you adding that actually add value to your system. And then over and above, we spoke, it keeps coming back to mental health, decreasing stress, which a lot of people, or let me say, a lot of us, we often are stressed out because of either things like work, whatever life things that are happening that we can't really do we can't remove from our lives. Putting in place practices that allow you to relax, take the stress down, go a mighty long way.
I think,
Absolutely. It's that ultimate balance.
can I just jump in about the mental health? I think for me, it's such a big issue that I think people don't understand how important that is. Mental health is such a massive thing. We know that from most data, about 85% of South Africans are under some sort of mental illness or stresses at the moment. It's not a Mickey Mouse disease, and particularly for guys, they must understand. We're considering, for example, that if you look at stress, it's like a hormone. It's actually going into your bloodstream, causing you to get heart attacks, strokes, loss of limbs, causing you problems even with perimenopause, early menopause for yourselves, even andropause for guys, all because of this. And I think it's so important for us to remember that mental health is not a Mickey Mouse condition. Please, let's address it.
Yeah, no, balance is absolutely vital. Absolutely. Because we think that, we're ticking all the boxes. I eat well, I gym 5, 6 times a day or a week. And yet, like, my heart rate is going, my stress, my anxiety is going. So, yeah, ultimately, it's that balance that we're striving for.
Yeah,
Now, Professor
absolutely.
Shangai, keeping on the topic of lifestyle choices are very important. What are the kind of lifestyle choices can men make to maintain their overall health and their well-being as they age, and particularly during that andropause period? What treatment options are available for men?
Oh yeah. I think again, it's not that complicated for the most majority of people. I think there are options for various medications and supplements which are necessary, particularly in about fork situations. One of them is one of the most important one, which Mpume mentioned, which is physical activity. And we're now shying away from exercise because physical activity. When we say exercise, everyone gets stressed. They think, oh no, you have to go do this 10,000 steps. 10,000
Mm,
steps, by the way, was set up by, it was about 30 years ago. A Japanese company came up with the first smartwatch and they just thumbsucked the 10,000 steps. It doesn't really, there's no evidence
the
for this.
doctor said
And,
it, guys. The doctor
yeah,
said it. We don't
there's
need
no
it.
evidence. It's physical activity and any amount of physical activity, including walking up steps,
Yeah.
riding a bicycle to work rather than riding. Then it's those that you need to do. And if you are doing a lot of very extreme physical activity, like Pumi says, I think we need to consider getting some supplements because you can lose out when it comes to that. And that the diet is not just about, it's about two main things. One is the numbers of calories. It's not the types of calories, it's the numbers of calories. It doesn't matter whether it's fat or thing. If you're having a lot of carbs, you're still going to get converted to fat. Numbers of calories is a problem, but also types, because we know that highly processed foods have many negative effects on our bodies, and we know that about 70 to 80% of calories in the American cohorts are coming from highly processed foods. They're affecting your microbiome, the inside gut and stuff, which are impacting on your general health, impacting on the fact of your weight gain or weight loss. It's such a huge thing. The third one, because there's only five, the big five of Africa, is smoking. And I don't want to pontificate, but smoking is the most important social choice you can make to help your health. If you smoke appropriately, which means smoke regularly, half of you will die from your cigarette. So it's just, and you're also spending so much money. We've got a financial things. Let's forget about it. Anyways, then the fourth one, excesses of any sort of drugs or whatever. And I'm not going to pontificate on that as well. I drink a bit of alcohol here. I know people that weed, and there's, even in Portugal, it's now legal to have any form of drug, which I think is reasonable, because it actually have shown that it actually decreases the chances of people dying and less people get addicted. But the point is, I always tell my children when I'm talking to them that alcohol, drugs, and everything, they're very nice. They feel good, but they're consequences. And that's where the problem is. You must remember that you're going to get consequences. And then we've discussed it already. The fifth one is stress. Mental health. Mental health is such a big issue. And guys are so particularly stressed about going to see a psychologist. Like, it's embarrassing. Please don't.
Yeah. No, I hear you 100%. That's very important. Dr. Zenda,
Yeah.
what are some of the most effective strategies for managing common symptoms like hot flushes, mood swings, sleep disturbances? Because I feel as if it's become almost like a sentence, whereas if one has a sense of, the toolkit on how to deal with these things, it just makes things a lot easier.
Yeah. So Tarryn, every time we talk about treatment for menopause, everybody thinks hormones, and they're like, absolutely not. I think we need to demystify the fact that hormone or hormone replacement therapy is bad. It might not
Yeah.
be for everybody. There are clients which, it will be contraindicated for to give anything hormonal. But when you look at the research and the studies, one of the most effective treatments is actually hormone replacement therapy. Yes, you need to speak to your doctor so that you can get what is suitable for you. And we do quite an extensive assessment of a person in terms of, are you suitable for? So we need to do a whole lot of tests. We need to exclude things. We need to do mammograms. We need to make sure that you're not predisposed to cardiovascular and thromboembolic disease, or what you call thickening of blood causing clots. That
Yeah.
becomes quite significantly important. Also, it depends very much on the symptoms that you are experiencing, because not everybody will experience all the symptoms. People will have different things that bother them. Anything
Yeah.
that disturbs your quality of life is worth looking at and treating. So first and foremost, when it comes to medication, there is hormone replacement treatment, which the core, let me say, treatment or medication that's there is estrogen. Of course, for women who already still have a uterus intact, we have to give estrogen together with the progesterone, because progesterone protects the lining of the uterus, and as a result protects you from having or predisposed to endometrial cancer. Then you've got lifestyle. We've spoken a bit about the lifestyle treatments. You do get other medications that are either used off-label, or used as sort of like an adjunct or an addition to things like, for example, tibolone, which is not a hormone replacement therapy, but it does stimulate hormonal or estrogen receptors to produce a little bit more of whatever is left of the estrogen. And then also want to treat things like sexual issues, genitourinary symptoms. Women who are either perimenopausal or already menopause are prone to sexual dysfunctions, whether it is pain during sexual intercourse, whether it is low libido, but also things like yeast infections are much higher. Urinary tract infections, and for some, not even for some reason, because of how everything is sort of like interlinked. Something like a yeast infection could end up leading to a urinary tract infection. Something like a urinary infection could cause a lot of itching, discomfort, pain when urinating, but that also can affect somebody's sexual function, in that they may experience more pain, less lubrication during sexual function. So it's all the adjuncts depending on what symptoms somebody is experiencing. And then, like I said, all the things that we've already mentioned in terms of lifestyle, decreasing stress, trying to keep that body mass index or BMI as normal as possible. Putting in, we often think just losing weight. It's not just about losing weight. Your body
Mm.
is very multifaceted. There's water,
Yeah.
there's fat, there's muscle. You want to increase your muscle bulk whilst you're decreasing your fat content as much as possible. So it's everything, but your doctor will be able to guide you based on just your current physical state, what is suitable for you, what is contraindicated, and then take it from there.
And it's knowing thyself, knowing thyself and knowing when thyself is changing, eh?
Yeah,
Yeah.
we're very afraid of our bodies, actually, particularly women. I noticed one thing. We often would rather just, you said it well, what we think, what we don't know is no news is good
Mm.
news. But no,
Yeah.
Yeah.
more
Yeah.
you understand your
Yeah.
body, the more you can tell when things are changing or have changed. The more prompt you can get, you can seek out medical attention and get it sorted out,
Absolutely.
or at the very least, get it prevented. That's even better.
Yeah.
That's
And I
because,
think
oh, sorry,
you
you want
said
to
a
say
couple of
something,
very
Chris?
important things. There are a couple of
Yeah.
important things, two important things. One of them is about weight. And you didn't say that you must have less weight. You said that you must have ideal weight for yourself. And that's the point.
Mm.
It's not like getting lost, losing weight is the only important thing, because you lose muscle mass, you lots of other things. It's the ideal weight for you. And you must make sure that you don't think that just because you're getting all skinny, that's going to be good. No, that's also going to be a weight problem. Getting too obese can be a problem, but sometimes they're the guys people who are bigger in inverted commas, who have good ideal weight for themselves. But then also the other one about the fact that everything's interrelated, and I think you were mentioning, I think it's the genital urinary symptoms of menopause. We call that now, which is what you were alluding to, which also includes not only the fact that you're going to get vaginal dryness, sexual dysfunction, you're going to get problems with yeast infections, bladder infections, but also rushing to the toilet, wetting yourself, coughing, sneezing, and also all these other symptoms that you get down there. They're all interrelated. And
Yeah.
I think this hype about hormone replacement being such a nasty thing, it's passe. I mean, this was like 10, 15 years ago. We know that if you haven't got breast cancer, there's really very little issues with getting onto hormonal therapy for the vast majority of people. And women particularly must get more into it, and including testosterone, because that's our
Oh yeah.
hormonal substance, guys. It's a big thing. And we're doing trials on testosterone for females with breast cancer vaginally. Works like a charm although we haven't published that data yet, but I think it's a big thing to look forward to in the future as well.
Oh, fantastic. And this is why you guys are the experts. You guys are on the forefront of the technology that's making way and the medical innovation that's happening. And this is why this kind of conversation is so important, because we don't just always casually sit down with doctors and have a fat chat. But yet we know that there's been massive breakthrough in all these like the taboos, and we don't talk about this and we don't do this because of what had happened 20, 30 years ago. It's great to debunk and just, give us the freshest news.
Yeah. I think what really is quite impressive about this is also, and I see it a lot with us women. We use a lot of Google, and when we do Google, we find all sorts of inaccurate information, and that can scare people a lot as well. So be very mindful of where you are
Yeah.
getting your information. Get your information from credible sources, so that you've got the real stuff and not being scared off by what's
And that
important.
your mental health is, is sane, because
That's
that
true.
makes you just as ill, right?
Yeah.
Oh yeah, definitely. And even
Now,
AI, by
Dr.
the way, AI is a big thing coming up, but there's so many inaccuracies there as well. So you have to be a little bit careful, have a discussion, and balance it out. Talk to your medical practitioner, and it doesn't have to be any specialist, by the way, even though we're specialists. Find your GPs are excellent people for most of these things. Your nurse practitioners are excellent people for this.
Yeah.
Have a discussion at least.
Absolutely. Dr. Zenda, how can women proactively reduce the risk of osteoporosis I actually went for a bone density scan the other day,
Mm.
because I know it's trying to be responsible, but also I'm entering that era in my life where I have to be aware of what's going on because things are changing. So
Yeah.
the risk of osteoporosis, cardiovascular diseases, dementia, and of course metabolic syndrome. Man, like, can we just like eat that burger with no stress? And of course, this all happening during menopause. Are there any specific lifestyle changes or medical treatments that can be specifically or especially effective in, protecting our health during this phase?
Actually one of the most effective strategies, and this runs across medicine, is prevention. And we spoke earlier on about, we often want to attend to the issues when they present. It's not too late, but it is late by the time you are struggling with, particularly our Caucasian women in particular.
Mm,
They are even more prone to things like fractures. So, and it's in practice, I know how difficult it can be, because you'll find somebody in their 20s living their lives and just, eating
mm,
however, not exercising, in their 30s, and then you hit the 40s and suddenly diseases are looking at you and staring at you. And
yeah.
now almost have to do twice as hard the work, but also your body is not as responsive as it was when it was younger. And that's why I always urge clients, put in lifestyle measures, not when you are approaching menopause, way before then. So, we spoke, for example, for when we're talking about bone density, the type of
Mm,
exercise, I watch this all the time. We like aerobics, we like sweating. That's great for your heart, but it does very little for your bones. You've got to
mm.
put in some kind of strength
Strength.
training.
Mm,
Yeah,
Sessions, yeah.
that increases your muscle, that increases your bone density.
mm,
Supplements we've spoken about, you need at least, you need some calcium supplement, particularly when you enter into your 40s.
mm,
Cardiovascular, I can't say this enough. You've got to be physically active. It doesn't just happen. And if you already have a family history of things like hypertension,
mm,
these are lifestyle diseases which can be prevented and can be avoided,
mm,
but it takes a lot of discipline, not just once, not just in one decade of your life, but throughout. And then the
mm,
other ones, unfortunately, things like, for example, menopause in itself and the decline of your hormones. You can't do anything about that in terms of that happening. But again, we've been
mm,
talking about just making sure that you're going to your screenings, so that as changes are happening, we can do some kind of treatment plan for you. We can replace any hormones. Prof. Shingai spoke about replacing testosterone. It has been approved
mm,
for women who have menopause. I prescribe a lot of testosterone for women, in particular for the genitourinary symptoms and sexual dysfunctions. So it's just keeping tabs on your own body, and as things come up, we treat, we sort it out. But the bulk of the work, a lot of us think it sits with our doctors, but actually not. It
mm,
sits with us and our lifestyle and how we look after ourselves. There's a
mm.
new, maybe it's not that new, but there's a thing that's going around, whether it's social media, where it's, taking care of yourself is an important part of self-care. Looking after your body is an
Yeah.
important part of self-care. Yeah.
Mm,
No,
mm.
definitely.
Professor Shangai, do you want to add on to that?
Yeah, first of all, I just like to comment on you two young, healthy ladies commenting on how you're running into problems. It's true, it can happen, but again, it's about taking care of your general health as well. So I think
Mm,
the important thing for everybody to understand is that you have to make the decisions in your life. A choice without consequences is no choice at all. You must make the
yeah.
choices for you. But even more importantly, in some ways, it's for your own family and your children as well. Because the thing
Yeah.
is that we know that, for example, in South Africa, we were number one in the world in 2012 and that was for obesity and overweight. We'd overtaken America, Canada, Mexico. We're
Wow.
now down to about 5, but it's still not great. But the biggest
Yeah.
worry is that 30% of our adults are obese or overweight. And again, it's not about weight, it's about health, because there are people who have got a lot of weight who are very healthy, but it's just about the waist circumferences and things that are going on. But 30% of our population are obese or overweight. But 30% of our children are also obese or overweight. And I'm going to bring my age. I'm much older than both of you. And I can tell you that in my medical training, if we saw a child with type 2 diabetes, we would have to publish it in a journal because it was so rare. Now, 12% of our children have got it.
Wow.
We are influencers. If we don't take control of our health and encourage our friends and family and everybody to also take control of the health from the beginning, like Mpume was saying, from any age, puberty, any time, take control of your health. You are going to impact in the future on your general health. It's so much easier to do it now when you're younger, like you two ladies, and then in the future you won't have to suffer so much.
Yeah. No, you're absolutely right.
Keep saying
Now, how
you're
can
young. I'll take it as a compliment.
embrace
It's
it,
not
girl?
about it's not chronological age, it's physiological age. We've talked about this thing many times. You've got patients who are in their 80s who look like they're 40, and they're 40-year-olds who look like they're 80. Which one is going to die? We know which one is going to die. It's about taking
Yeah.
care of your general health.
Absolutely, yeah. Yeah.
Now, talking about taking care, how can partners or loved ones support their significant others during the andropause period or their menopause period? I mean, like, what are effective ways for couples to just maintain open communication about these changes? I think that often, it's that block in communication, that misinformation, that ignorance, that don't know what to do, don't know how to navigate, that causes so much conflict and challenge in a relationship. I'm going to start with Dr. Zenda, and then I'd love for Professor Shingai to also just follow up as well. What has been your guys' best advice in this space?
Yeah, this is a tricky one because even before menopause, men and women often struggle to communicate, particularly when it comes to romantic
Mm,
relationships. Now,
mm,
because we are wired, yes, there's a lot of similarities, but we're still wired quite differently.
yeah.
When I don't express to my partner, for example, that I'm dry because of menopause during sexual intimacy, they may interpret that as maybe I'm not attracted to them anymore. Now
Arousal,
you're adding
yeah.
on a psychological thing, you're adding on sort of like reading between the lines and stuff. So,
Mm,
first and foremost, the individual themselves, know yourself so that you are able to articulate to your partner. If you have gotten, for example, this webinar is great because you can go back literally and be like, oh, the reason why I've got a bit of brain fog is this is what is happening. This is the
mm.
phase that I
Yes.
am in. And
Yeah.
then the people, and it's not just the partner, it's also the children. I've often said it's probably the most wicked thing to have parents who are going through andropause and menopause and teenagers who are going through puberty all in one house. It's a hormonal chaos, literally. And
Oh.
and if nobody understands what's happening in the
Mm,
biological and physiological sense, we are likely
mm.
to then start making it as if it's, we're fighting, we're not getting along. Now the psychological, the atmosphere within the home has changed completely just out of misunderstanding. So first and foremost, when we understand ourselves, we can articulate better to the people, to our families and the people that are in the household, and also to articulate how we would like to be supported. Women, we are amazing creatures, and very often we kind of like expect guys to telepathically know how they can
Mm,
support us. Let them know. If you want space, ask for space. If you want intimacy, ask for intimacy. If you don't want the kids around, get the kids out of the house, ask them to be, and stuff. People are often more understanding and empathetic towards us if we can articulate how we want help and what are the things that are bothering us at that point.
mm.
So it really just goes across not just with the partners, but in particular with the partners. Very often the partner can feel left out, can feel like they're no longer attractive, or just because of the things that are happening in your body. Explain. If you find it difficult, one of the things that I do quite a lot is bring the couple together, bring the couple to the consultation and explain to both what are some of the changes, what does that mean, what can we do, what can we add to that. And it's also a really great time to spark up things, try new things, try new experiment with other things in your sexual life, in particular. The kind of sexual intimacy you were having in your 30s and 40s, best believe me, yes, it does get better with age, but it's not going to be the same. The kind of energy, the number of rounds that maybe you're doing, and it's nothing to do with, that you feel less attracted to your partner or you're not interested in sexual intimacy anymore. Very often it's just those changes that need you to do things slightly differently.
Prof?
Yeah, I think you even hit the nail on the head. It's communication. Communicate. Women are much better at communicating usually, but even as we get older, as women get older, they also start losing that ability. But guys are so useless. The biggest sex organ is the brain, and the brain connects to the ears and connects to the mouth. And you have to be careful with what you do. And for the guys in heterosexual relationships out there, you must remember, I said that the best sexuality for guys is 18 to 22. For females, it's from 40 to 45. Far out, we start deteriorating there. And if we haven't communicated, we've got a problem. And there are a couple of small things which, from my experience, that when I talk to my patients, two of them are that, first of all, when you must communicate, you must talk. I've got so many patients who come in and they say, no, I know my partner is saying my penis is small. And I say, but have you talked to her? No, but I can see it. How are you going to see it? How long have you been with her? 20, 30 years? You've never talked to her? She's supposed to be rubbish. Second, I mean, like, I've got patients who come in and they say, oh no, I'm getting divorced because my penis is smaller, because my erections aren't good. And they've been and she's been saying this for the last 3 months when I asked them, but they've been married for 30 years. It's not about your penis. It's about the way you're communicating. Communicate. And the second one, which is a little bit more simple, and again, because our mentor, Prophet Oldham McIntosh, always says, lubricate. When you get to menopause, don't worry about lubrication. Moisturize, lubricate. It doesn't matter. It's not because she's not turned on. Lubricate. And for you as a guy, if you've got a problem with your erections, if you've got a problem with ejaculating too quickly, if you've got a problem with your libido, remember, it's not only an impact on you. We know that it impacts on your partner as well. It causes the partner to have a problem as well. So if you're not going to do it for yourself, at least do it for her.
And last but not least, sorry, Tarryn. Last but not least, I always say sexual intimacy in particular is such a big spectrum. We often are so fixated on erections, on dryness, and so on. Your hands and mouth work just fine.
Oh yeah, I like the joke. There's a joke that I always like to tell about the couple who are getting divorced, and the wife says, in 30 years of marriage to you, I faked orgasm every time. And for a guy, that's a big issue. We get stressed. Orgasm, women don't always have to have orgasm, by the way. Only 20% of them get it from penetrative sex and alone. But the guy says, okay, fine, I'm going to be mean to you too. In 20 years of marriage to you, I faked foreplay every time. And they foreplay. That's what makes women need to be stimulated. As I said, only 20% of women get orgasm from penetration alone.
Yeah.
You need to do other things: lick, touch, buy flowers, take her out for a dinner 2 days before. These things make a huge impact to improve your sexuality, because the average guy, at least in America, will ejaculate within 2.5 to 5 minutes of penetration. Even if a woman has sex and gets orgasm from penetrative sex, it takes between 20 and 25 minutes for her to get it. How do you bind this? Foreplay, talk, lick, touch, do things. It makes a difference and improves the outcomes of your relationships, particularly.
Yeah, 2.5 minutes is a problem. So, yeah.
Tarryn,
Sure,
you
I
were
actually
She's part of
no, I actually want
your
to.
society now. There we go.
Listen, I quickly want to find out from you because we kind of answered the question that I was going to follow up on next. But specifically for men, because we have these stories out there that men can have children till they're 80 years old, and women just switch off after 50. So my question is, how does intimacy and sexual health evolve for men at this age? In which way does andropause influence a man's libido? And what measures can they take to adapt and uphold that vibrant sexual health, and just to navigate through this aging process?
Oh yeah, I think there are two important points here. First of all, for guys, it is true that almost every guy will be able to produce sperm until they're dead, basically, even if they're Methuselah at 50
Mm,
years. But although that was never proven, but we don't know. But the fact of the matter is that we know that there's a diminishing efficacy of our sperm, and we're more likely to get problems like, for example, with genetic abnormalities and stuff. So again, you have to balance about how we know that we're starting to try to have babies later in our lives because of our professions and stuff. But if you're looking for
yeah.
children, you have to be a little bit careful. But remember, sexuality is important for the whole life. And there's good French data which we peer reviewed a number of years ago, which showed that if a guy over the age of 60 has sex twice a week rather than twice a month, and by the way, all these multiple rounds things, guys, don't get stressed. Your penis is fine. It's normal size. Relax. Don't worry about that, first of all. You don't even have to look at your penis to know it's fine. Second of all, you're having enough sex provided you are talking to your partner. Because not everyone wants to be pumped for the whole night or whatever. You must relax.
Yeah.
But the point is that if you have sex twice a week rather than twice a month after the age of 60, barring all other comorbidities, be it diabetes, sugar diabetes, blood pressure, HIV, by the way, please get yourself checked for HIV. If you have HIV and you're put on treatment, you have the same life expectancy as everybody else. So don't be worried. But if you do have sex twice a week, you get an increase in life expectancy by 6 years for guys. For females, it's 8
Wow.
years. 8 years. Sex is a form of exercise. Do it more. Don't be worried about your age, and particularly not worried about your
Wow.
chronological age, your physiological age. Get on with it.
Wow. Yeah, you come with golden, valuable information. This is, I mean, wow. This is
get on
important.
with it.
Wow. Now, before we wrap up the conversation and get to the questions, because we have quite a few that has come through on our quick comment section, there's a lot of information and opinions about hormone replacement. And we spoke about this very briefly earlier. But Dr. Zenda, can you provide some clarity on the benefits and the risks associated with it? Because I think that while we are saying, it's safe, it's good, go for it, it's important to understand also, the pros and cons of it. So how does one decide if you are the right option after all the testing, etc., etc.? We need to know the good and the bad, the good, the bad, the dirty, you know what I mean?
There we
Yeah.
go.
So a lot of our hormone replacement is either in the form of a tablet, so we have to take it in. Sometimes you do get it in patches. Sometimes you do get it in some kind of what we call implants.
Yeah.
So that means it actually has to bypass, your liver, and has to be literally into your system.
Mm.
That kind of hormone has been, particularly the estrogen. The estrogen is the biggest culprit in terms of the risk of things like breast cancer, increasing breast cancer, thromboembolic disease. We know
Yeah.
that stuff that you take orally in particular, or the stuff that has to go into your bloodstream, it has a slightly higher, and Nakona, it's not by that much. I think it's about 1 to 2% higher than the stuff that you take transdermally, so the creams that get absorbed. So what is best for a person, it literally depends on their medical profile. Anyone who's got a family member, a primary family member, for example, a mom, an aunt, who has had breast cancer, we are often very cautious about giving estrogen therapy to that person. But even those clients, if they've done sort of like and excluded the genetic, the BRCA genes that are related to breast cancer, for example, if we have excluded those patients can still also be, especially if the kind of symptoms they're experiencing are affecting their quality of life. So it's not just about, it's not black and white. It's looking at all those things, family history, anyone who, we often discourage women from having, for example, oral contraceptives after the age of 35. But that in itself has to look at, for example, are you predisposed to hypertension, diabetes? What's your BMI? What's your lifestyle like? You can find somebody who is in their 40s who is very well kept, and we are able to give something like oral contraceptives, and somebody who's in their mid 30s who is obese, has other medical conditions, and we absolutely cannot. So there's something we call eligibility criteria that we go through with each individual to assess if they are suitable or not for hormone replacement therapy. I think that the take-home message when it comes to hormone replacement therapy is it's had this really bad rap, and we've been talking about this. It's had this really bad rap that people don't even go and inquire and ask about hormone replacement therapy, let alone things like, for example, genitourinary symptoms, incontinence. A lot of women are very embarrassed to even say that or report that to their doctors because it's embarrassing. But there's treatments for those kind of things, and so I encourage every single person, every single woman and man who is going through that. Your symptom is valid. If it's affecting your quality of life, discuss it with your doctor. And then we often look at it in terms of holistically, what is suitable for you. But the cornerstone of hormone replacement is estrogen. And there definitely are clients that we opt not to, and then we'll find other alternative medication or alternative treatments. But for the majority of women, hormone replacement therapy is a very, very important therapy that they can use, and it really does improve a lot of the symptoms. Yeah.
I think that
I
quality of life
see.
point is so important, because I think people don't understand that quality of life is the most important. Often it's not just the length of life. And if you're having quality of life issues, find somebody to help you with it, even if your current physician is not helping you. Sorry, Tarryn, for cutting.
No, no, I mean, trust me, I could sit and have this conversation for hours, but we are soon approaching that 1 hour mark, and we have questions. So let's just dive straight into it so we can get to as many as possible. First question: can women still go through menopause even if they've had a hysterectomy?
Absolutely, yes. In fact, the menopause is less about the uterus or the womb, and is more about the ovaries, because that's where the sex hormones, the estrogens, the testosterones are produced. So yes, a woman can. So let's say, for example, somebody has a hysterectomy for fibroid uterus in their late 30s. If we only remove the uterus, which generally is what we will do in somebody at that age, and leave the ovaries, that person doesn't go through menopause at that time. They will go through menopause naturally, depending on hereditary and so forth. But the opposite is also true. Anybody who gets their ovaries removed younger, we are literally rendering that person into early menopause. And actually, that type of menopause is worse off in terms of symptoms compared to somebody who goes through menopause naturally. So whether it is a result of a cancer, or whether it's a result of a tumor. Sorry, say that again.
Is it ectopics or something like that?
Yeah, well, ectopics generally will be more in the tubes, and we often don't interfere much. Yeah, we don't really interfere much with the ovaries. But anytime you interfere with the ovaries and you either remove them for whatever reason before menopause, you've rendered that woman menopausal, and you need to please make sure that they are on some kind of hormone replacement therapy, because they naturally will experience the symptoms worse off. We see this a lot in the patients who are diagnosed with breast cancer in particular at a younger age, less than 40. The medication that we give them, the treatments that we give them, it suppresses literally all their estrogen, and therefore they become symptomatic as menopausal, and it's important for them to be on some kind of treatment. It's tricky with those ones because you still can't give them anything to replace that estrogen, but we find ways of dealing with the different symptoms that they present with.
Professor Shingai, just a quick one here. It's Men's Health Awareness Month. What are some of the important health screenings men should be considering at this age?
Very good question. And again, it's pretty much the simple 10-minute assessment. Go to see your physician if you're feeling sick or not. If you're feeling sick, even more important to go and get checked by your treating practitioner. Get yourself having history. We find out the history and examination give the diagnosis for 80% of all illnesses in medicine.
Yeah.
If you've got a problem, we'll ask difficulty passing urine, this, that, and the other. This thing of feeling hot when you've got blood pressure is rubbish. Getting thirsty because your diabetes is not, you might have diabetes, rubbish. You need to get them checked. So you get a full history, takes about 5 minutes less. We do an examination, checking that there's no big lumps, this, that, and the other. Make sure that there's no other problems there, no rectal examination necessary. And then literally blood pressure, sugar, cholesterol. If you're over 40, a PSA, prostate-specific antigen. After 30, about the testosterone, which should be done in the morning because it has something called the circadian rhythm, because it goes through like a cycle. You get a higher testosterone during the morning before 11 o'clock, and it should be checked before that. Literally, you're done. You get it out. The only proviso from this is just to remember in the back that colon cancer is such a big issue for Black patients, both male and female. Unfortunately, we've got a very high rate in people under the age of 40, 30s, and often there are very few symptoms. So you should also be considering possibly doing a colonoscopy, particularly, which is looking up your buttocks with a camera, or doing some blood tests or your stool tests to check what's going on, make sure there's no cancer there. After about around the age of 30, particularly if you've got a family history of cancer, particularly colon cancer.
Yeah.
Yeah, that's great to know this. It's very important. So, to our Instagram followers and viewers, I urge you to make your way over to our Facebook platform or our YouTube platform, the Clicks Facebook page or the Clicks YouTube page. I know that Instagram cuts after 1 hour, but we're not stopping now. It is way too juicy. We are just on a roll here. We need to keep this fire burning because it is just so valuable. My cup is running over us. I want to keep the conversation going. So make your way over to our Clicks Facebook page or our YouTube YouTube page, the Clicks page, so we can just keep you going. I'm sorry, I know that Instagram is going to cut you soon, but there are other platforms. I want to go into the next question. I've got one that has come through saying, I am 47 years old and I'm told that I am in my menopause era, but I'm still getting my period. What advice can you give me on this matter?
Right. So she's definitely not, if she's still getting her period, she definitely has not menopause. She probably is in her perimenopausal phase, just based on the age. So there definitely will be things like, for example, particularly relating to the menstrual cycle. You'll find that it starts to become irregular the closer you get to menopause. So you may find that you're missing 2 or 3 cycles and then you get 2 cycles or 1 or 2 cycles or so. And that can be quite confusing. It is even more confusing for the woman who's on some type of contraception, particularly the ones that are like the injectables, which actually render you with no periods at all, because those women very often, they're actually not sure whether they've menopause or not. So always check what contraceptive are you on at that time, but she definitely has not menopause, most likely going through her perimenopausal phase.
And then the last question, and as I said, I would have loved to go on and on and on. But yeah, you know how it goes. We are on a time limit. Last question. Could you advise on how one differentiates between the symptoms associated with normal aging and those indicative of menopause and andropause? Do you want to start that one off, Professor? Professor Shingai?
Oh, okay. Yeah, I think generally, again, it's about your own individual person, because there are so many there are many things that can, for example, mentioned that testosterone is the most important hormone in men, and there are only actually two ways that you can increase your natural testosterone. One of them is a vitamin called niacin, which you have to take in massive dosages, and and from what we can gather, it increases the testosterone, but it doesn't improve your health. So that's not the other one is a better solution: exercise. Exercise raises your natural testosterone, both for men and for women. That is, and if you're doing this and you're generally taking generally good health care of your health, you can actually maintain, as I repeat, the physiological age, and you're going to decrease the chances of you getting into the andropause, but you're also going to decrease the symptoms of the andropause. So I think the important thing is for us to make sure that we take good lifestyle choices, make sure that we take good care of our health, and then if we do that, we can delay or even mitigate and stop it completely from happening, because we've got lots of guys. I've got lots of guys in their 80s and 90s with perfectly normal testosterone, no problems with libido or sexual dysfunction, mainly because they've been taking good care of their health.
Wow. Okay. That's great.
Yeah. I think one of the biggest challenges for women in particular is that in our reproductive phase, and especially for those who have children, we subsequently gain a lot of weight, a lot of lifestyle, things go out of the window. We are parenting and stuff. I think I can't emphasize how important it is after childbearing, or immediately after childbearing, or in between. Just don't forget yourself. Don't forget to take care of yourself, because this is what, as we've spoken, sets you up for a better and a healthier quality of life in your 40s, 50s, and beyond. So, we can't, there's no treatment for aging per se, other than what you do, what you put in terms of your own body. That becomes really, really the important thing. And just be happy. I think we take for granted how important emotions. We speak about, decreasing stress and whatever. One of the big things that I've found helps a lot of clients is they're stressed out because of work, because of relationships, because of all these things can't do much about, or that are not going anywhere. But we often lack giving them sort of like guidance in terms of what can you do to improve the positive emotions, things like finding hobbies that you enjoy, things like just being able to detox your relationship, things like spending time alone. People run away from spending
that's it.
things like having lots of, you said what, how many? At least twice a week. I say minimum 3 times a week.
I like your attitude. I like your attitude.
That's the spirit.
Sexual intimacy even for women. I mean, it improves your mood. It decreases menstrual cramps. It just makes you overall healthier. So there's so many things, and I love the fact that a lot of what actually happens when it comes to mitigating or just slowing down aging has actually very little to do with your doctors and your healthcare providers. It's on you. That means you get the ownership of your good health.
Yeah. Aging is a state of being, eh? I suppose it's a holistic approach to everything.
Yeah,
exactly.
Absolutely.
Even the meditation, spiritualism, all of these things are so intricate to making sure that you maintain a healthy lifestyle.
Yeah. Oh gosh, man. I can't tell you how amazingly, thrillingly informative this has been. I'm excited to have my next coffee date. Guys, did you know you can get 6 years on your life? You just need to do the thing. I just want to go out there and share the gospel. Yeah, guys, thank you.
Science.
Thank you. Thank you.
Thank you so much, Tarryn.
Dr.
Thanks for
Yeah,
Thank you for
Dr.
being an amazing
Zenda.
host, Tarryn.
Exactly.
Listen, pleasure's all mine. Professor Shingai, Thank you. Thank you guys for navigating us through this very important conversation. And I hope and pray that it continues, that we continue to add on it the new innovation, the new information, the new journals, the new breakthroughs, so that we are conscious, present, constantly evolving people that are always ahead of the curve and just empowering ourselves to live happy, balanced, beautiful lives. You've shared some insightful knowledge, and I'm sure our viewers are bursting with gratitude. Are there any final words or advice, that thoughts that you guys would like to share before we say hasta la vista? I can start with you, Dr. Zenda.
Menopause is not a sentence, a death sentence. It's not.
Mm,
It's not an event. It's just part of growing up, and the more you get to know yourself, and take care of yourself, and have a great relationship with your doctors as well, and constantly badger them
mm,
about screenings, you will find that actually, I think I'm tempted to believe it's actually the best time for women. No kids, no pregnancy,
really?
no period. Come on. Great,
Yeah,
amazing
I
intimacy.
love that approach.
What more do you
Yeah,
want?
That's it.
absolutely.
Yeah,
Professor Shingai, anything you'd like to add?
yeah, I'd just like to say that I think this has been such an insightful discussion. Thanks for hosting it as well. But I think we must remember that you are the one, you're the controller of your health, but not only the
Yeah.
health for yourself, but for everyone around you. And that includes your mental health. And I think we need to make sure that we actually improve our general health as a totality,
Mm,
but also an impact on everyone else around you. And if you do
mm.
that, you're going to make a great impact on your own life and improve your general health. And by the way, guys, just because you've got low libido sometimes no good erection, sometimes if it happens once in a while, we have failures sometimes. Just like females also, they can have some dryness sometimes, but lubricate, lubricate, lubricate. Please lubricate, guys, lubricate. Okay.
Yeah, more power to the lubrication. Thank you so much, guys. I really appreciate you guys joining us tonight. Wishing you well, and yeah, may you continue to add value to people's lives, because that's what you guys are doing. Besides being amazing doctors, it's the value that you come with that's most important.
Thank you so much,
Thank
Taryn.
you.
And you're always fantastic as a host.
Thank you. Go well. Till next time. We'll see you guys soon. Now, I just want to say a massive thank you to each and every one of you for joining us tonight as we go into this insightful discussion on menopause and andropause. The journey of overall health and well-being is ongoing, and of course clicks is with you every step of the way, and that is truly a pleasing thought to know. Guys, I hope that this webinar has provided you with valuable information, a deeper understanding on, how to make informed choices about your health. And remember, menopause and andropause is a natural part of life, and we are part of this shared human experience that is deserving of open conversation and support. And that is exactly why we have this platform, so that we can have conversation about this, normalize this conversation, and just start new generational habits of just being comfortable, safe, secure, and know that everything's going to be okay. Now, I want to urge you to follow Clicks, and of course, hashtag Clicks Wellness Experts on the socials for more advice, and of course, all the latest offerings with all this new innovation that we were talking about tonight. On behalf of Clicks, I want to thank you again for joining us. Stay healthy, stay safe, and until next time, good evening, guys.